Guys, welcome back to Medical Coding with Blue. So, something new I wanted to start doing is maybe like once a week, go do a deep dive into a particular diagnosis so that we can kind of look through the book and look, at different ways of better understanding these diagnoses. So, whether or not you code for a particular clinic or a particular diagnosis section, you should always try to understand everything, whether you do it or not, like I said, because it's important to be very well rounded when you are a medical coder and try to learn everything as much as you can. And I think taking little bites like this can kind of help with that. So today we're just going to talk about Alzheimer's. And something that I like to do when I am trying to learn about a particular diagnosis is, of course, I reference a book because you all know me and my books already. But I also like to go on the web and see what kind of websites that they have about a particular condition. And for Alzheimer's, I did find alz.org. This website is wonderful. It's got so many references about Alzheimer's on it, and it is really good to understand, and it's very quick, and you can see it, and it breaks it down. It's not like really it's not broken down where it's like really complicated. It's very easy to understand and to look at it and absorb this information. So when you have a chance, check it out. Maybe it'll help to answer some questions about things that you may have wanted to know about Alzheimer's and things that maybe you didn't think you wanted to know about Alzheimer's. So, but going back to the book now, Alzheimer's is always going to include a F series code, which is, for this particular case, it's always going to include dementia, which is F02.8, and then that fifth digit is going to be either a 0 or a 1. Now, if it's F02.80, then it's going to be without behavioral disturbance. And then if it is F02.81, it's going to be with behavioral disturbance. So let's go back. When you look up Alzheimer's in the book, it's going to tell you to go to disease and see Alzheimer's. So you go to disease and you see Alzheimer's. Then you see the category code, which is G30. And then you're going to see you're going to see without behavioral disturbance and then with behavioral disturbance. And next to each one of these is a bracket next to that G30, right? So that little bracket is telling you that you have to code that in addition to that main category code. Okay, so just like when we had the BPH and we had to code separately all of those other symptoms, basically that can go with BPH, for more detail, it's the same thing. So in this particular case with Alzheimer's, according to the tip in the book, it says to code from the subcategory F02.8 should always be assigned with a code from this category, which is the G30, right? Even if there's an absence of documentation about dementia. Okay, so it doesn't necessarily have to say that the patient is demented. If they have Alzheimer's, then you're going to be looking for if they have some sort of behavioral disturbance or if they don't. Okay, so you can code those two codes regardless of whether or not it's documented that the patient has dementia or not. Okay. And that's according to the book. So let's talk about what it means to be different types of Alzheimer's. So we're only going to talk about early onset and late onset today. Okay. So early onset is rare. Okay. And the clinical presentation of this is like symptoms that start like in their early 30s, but most times it's going to be between their 40s and 50s. Okay. And then late onset is very common and is usually occurring around age 65. So again, it's important to know and understand these things, especially when you're looking at this documentation. Now, you never want to infer any of this information. I'm just telling you this so that you can kind of be aware of what you're looking at. But always go based on your provider's documentation. So, because they are the provider and you are abstracting this information, but you want to make sure that it is as detailed as you can be. So again, you're always going to have two codes when you're reporting Alzheimer's. One code is going to, the second code for the Alzheimer's is going to be either with behavioral disturbance or without behavioral disturbance. So when you're looking at behavioral disturbances, what are potentially some behavioral disturbances? Okay. Aggression, I wrote it down, anger, anxiety, agitation, depression, hallucinations, like memory loss and confusion. These are all behavioral disturbances that go along with Alzheimer's. So if your provider is stating in the documentation that the patient has Alzheimer's and they have been getting aggressive lately, obviously you're going to pick the diagnosis with behavioral disturbance because they are getting aggressive according to the provider's documentation. Okay, and so, and like I said, it does not have to have the dementia documented specifically because you're always going to code an additional code with that Alzheimer's code of G30. Okay, and it's very interesting when you get into the section of the book because it tells you to code additional and see additional. So make sure that you pay attention to those. This is one of the ones that you really want to get sharp with too, because it is so, it's very important to make sure that these codes are picked up fully, okay? Because there's so many things that can be covered in this category. And wandering is another common problem with Alzheimer's. Now, wandering is very dangerous because obviously, anything could happen or anything could have happened to the patient. Obviously, they can get very hurt, but if the provider documents that the patient has been wandering, there's another code for that as well. So you're going to be picking that up in addition to. So if they are aggressive and if they are wandering, you would pick up the Alzheimer's with behavioral disturbance with the wandering, and there's a wandering code in here. So just be sure to look very closely at those things. As I said, alz.org is a wonderful website to look at and to try to better understand, some of the things that happen with Alzheimer's, and this is when you can really start looking at your provider's documentation and making sure that when you do ask questions, if you do have questions for them, that you can ask educated questions and they'll be able to tell, oh, she's been doing or he's been doing research to see, what questions they should ask, because you always want to be able to show that you've done your research, you've done your background looking at for, whatever diagnosis problem that the patient has before you go and you ask your provider questions. Okay, so but as I said, if it absolutely does not make sense to you and you've tried, then you can tell them, look, I did this and this, can you please try to help me understand what you're saying here in your documentation? Okay, if it's confusing. Okay, so yes, and that's it. So I think I'm gonna kind of do this a little bit more. I did write this today, so just something to kind of think about. If you guys want me to do a deep dive on a particular diagnosis, let me know, and we can talk about it, whether it's diabetes or hypertension or any of the other big ones, osteoarthritis, anything. So just let me know, and I guess I will wrap this one up. So it's just been a very hectic, and I always say it's hectic, but yesterday was really hectic. And that's why I didn't film yesterday, and so sorry. But I wanted to thank everybody, the new subscribers. I'm really impressed with you guys because all of a sudden, it's coming on, and I'm really appreciating the growth of my channel. I really appreciate it. It's very exciting. So yes, I will be back tomorrow for Quiz Friday, and I'm very excited. And I will be throwing some Alzheimer's ones on here, so that way you guys can have something to practice on too with that. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, if you are a provider or a nurse, I invite you to like and subscribe to my channel, and I would really appreciate it, and I will see y'all on the next video. Bye!